Hi, my name is Taimur Shah. I'm a consultant urologist. I have a clinical post at Imperial College London and also an academic posting. My background is predominantly in clinical research in urology and in particular for prostate cancer, where I've helped develop and been involved in part of the studies looking at imaging such as MRI, PSMA PET, transperineal biopsies, fusion biopsies, focal therapies such as HIFU and cryotherapy, and robotic prostatectomy. Always a very difficult question to answer, why one becomes a doctor. I think I'm going to change the question slightly and tell you why I became a urologist, because I think most of us became doctors because we enjoyed sciences and we wanted a career which allowed us to interact with other people, other human beings. But in terms of why I became a urologist, it was quite early on actually in my medical career where I realized it was a specialty that treated patients quite holistically. It wasn't a typical surgical specialty where every patient needed surgery. There were big medical aspects to it about managing the patient's well-being, managing their medical conditions, often without medications, but then there was a whole medical side to it as well. And then the surgical variety was what absolutely amazed me, where we have some smaller open operations, we have keyhole camera-based operations, which we call endoscopic, we have big open operations. And what really got me interested in urology was actually the robotic surgery. And we were the first speciality worldwide to really take this up. And I was early on in my career in some of the hospitals which were deploying robotic systems. And I essentially thought that's the sort of surgery I want to be doing. It's something that just allows you to do your operations with so much more finesse. And ultimately that leads to better outcomes for patients if we can do the operation more accurately. There are quite a lot of rewarding aspects. Probably the first one is seeing patients who are happy, and it's obviously not always easy to have patients who are happy when you're often dealing with patients with cancer. But the gratitude that I receive actually is probably the most rewarding part of my job. There are other parts that I also really enjoy. I mentioned that I initially came into urology because I found robotic surgery very interesting, but then since that, I have done a lot of research into imaging, but I've also done a lot of research into newer treatments for prostate cancer called focal therapy, such as high-intensity focused ultrasound and cryotherapy, and now looking at also using a newer device called NanoKnife, which is irreversible electroporation. And it's this kind of the technological aspects of the surgery, the research that is really important, also embedded into a lot of my practice that I probably find as rewarding as some of the patient interactions I have on a day-to-day basis. I believe in joint decision making. I believe in being open with patients and not having this sort of paternalistic style of medicine that used to be practiced in the past. So personally, I try and have open discussions with patients, ideally in a manner that they can understand, and I hope to be able to get that back from the patients, where we together discuss the various aspects of their medical treatments, their surgical treatments, and we come to a decision together. And that's probably, I hope, what patients value about me, and that's what I most value about patients as well. I don't tend to use mantras, but there is something that I always fall back on in life, and it works in my clinical medical career as well, which is that if I've thought about doing something, then I should just do it. Whereas often it's very easy to think of something and not do it, but if you've thought it, you should do it.